opportunity. This is my disclosure. And thoracic spine generally has been polyresolved spine surgery. We cannot mobilize the thoracic spine, and compression is, or retraction is very difficult. So for the posterior approach, generally we have been doing lots of bone removal, including laminectomy, facetectomy, even removal of the pedicle and the corpectomy, so we can just approach it. So in the last 10-15 years, we have been doing many lateral position approaches with the access surgeon, including thoracotomies that require an access surgeon, but as well management of the thoracic approach, including chest tube, ICU stay, and so on. Now, the procedure that I'm going to show you is actually based on two other procedures that we have been doing for a very long time. We have more than 1,000 cases for this OLLIF, and I want to my predecessor talked about OLIF, anterior to psoas or oblique anterior lumbar interbody fusion. This is very distinct from that. This is a posterior approach, all done in prone position, and a modification of that is more lateral, practically both in prone position, one through the Cambine triangle, one anterior to the nerve root. The 1,000 cases that we did here gave us the experience that we could then take those experiences and apply it to the thoracic region. This is a minimal invasive, and this is an open surgery, as you see, and we know the minimal invasive is not about the skin incision. What you do under the skin is going to make it minimal invasive and reduce the damage. And there is enough data that the minimal invasive is overall safer, and it's actually, in many regards, going to make the recovery much faster. I'm not going to go on that, but the data is accumulating significantly in that regard. So there is a reason that we should start thinking about minimal invasive thoracic approaches. And here in our approach, we utilize the same methodology, meaning all in position, in prone position. We make a ½ incision in the intercostal area in the posterior axillary line. This procedure can be done at any level below the scapula. Then we will run the probe, a blunt probe, along the rib. We position that probe then in the posterior third of the disc, and then enter the probe in, put a tube in that is 8 millimeter in diameter. That 8 millimeter tube allows us, with the same instrumentation that we use for the OLIF, and again we have done thousands of that, enable us to do the discectomy, prepare the end plates, and put a cage in. In the bottom right, you see the cage placed, or the shadow of the cage. From our OLIF study with 1,000 cases, we know what the fusion rate is. We know that the disc preparation and end plate preparation can be done safely and efficiently. And here is the result. Interbody fusion, and we complement it with the percutaneous posterior fusion, and all done minimal invasively. And this is the 3D rendering of it. And here we see the end result on patient's back. Now, most of the studies are done on about 24 of cases. In one-level cases, our skin-to-skin time is 46 minutes in average. Our blood loss is under 100 cc, and vast majority of patients go home within 24 hours because they are ambulating within 24 hours. As a matter of fact, I show you later on, 96% of them. Two-level result are comparable. Learning curve from the OLIF can be transferred here. 40 cases is needed to be efficient, but many of those cases, learning curve can be accumulated with the lumbar surgery. As well, from the lumbar surgery, we know that the BMI does not affect the length of the surgery or complication rate. Every 30 minutes in the surgery, there are enough data there. It adds 70% combined risk to the surgery. So if you make a 4-hour surgery, a 1-hour surgery, you're actually making the surgery safer. Here, the result for TLIF, for MIS TLIF in red, and then green, the OLIF, the result for the thoracic cases are very similar. And as well, this is one of my last slides that shows that 96% of our patients ambulate within the first 24 hours. And the result is for the thoracic region actually very similar. 2/3 of the patients are discharged under 23 hours. And if you have questions, please just look us up. We have educational venues for this. just Google inspirespine.org and we can give you all the information you need. Thank you very much.